BMI is categorised, between 25 and 30 is categorised as overweight, over 30 is categorised as obese, and 40 or more is categorised as morbidly obese. It's the women that have got BMIs of 30 or more in pregnancy that the ones that we should be looking at. Now, for the midwives in the audience, you know that if you look at NICE guidance, we're looking at 35 and above being the point that we start looking at where people are going to be giving birth and saying that's when the problems occur during pregnancy. But actually, the 30 to 35 women are the ones that we really need to start looking at, and I'll explain why in a minute. This is called the fat map. You can see by the fact that there's a little red sore thumb sticking out why Wales were probably the first place to think about doing something a bit different with this. We have got a major problem with obesity in Wales, and that links with things like deprivation. It also links with heart disease and some of the cancers as well. So obesity is very, very high on our agenda. In fact, we've now got a maternity strategy that's just come out where public health is very, very high on it in Wales because of the issues that are around it. So the obesity trends, if you look at where, and we've only got England stats on this, but if you look at where England are going compared to the States, and we also always all know what's happening in the States, you can see that actually we're mirroring what's happening in the States. So our obesity epidemic is rising and it's not stopping. And I've been a midwife for more years than I care to remember. But if I look at the women that are walking through our doors now compared to when I first started over 20 years ago, then I can see the difference myself. If you look at something like the CMACE report that reports on why women die in pregnancy, we've seen from that obesity is now a major part of that survey, whereas about 20 years ago that wasn't the case. This is why, as midwives, health visitors, school nurses, we should be really concerned about what's going on with children at the moment. Because if you look at the obesity levels here, and Wales unfortunately is third on this list, and England, Scotland and Ireland are about halfway down. This shows the obesity level in children that are 15, and this was in 2005 to 2006. So these children are now becoming childbearing adults. And if they're obese at this level, then actually by the time they come into pregnancy, they're positively going to be obese, most probably. Okay? That means that our maternity services are going to drastically change, because if you've got a majority of obese women coming in pregnancy, we are not going to need midwifery-led units, we're not going to need home births, all we're going to need are consultant-led units with high rates of caesarean sections and high rates of inductions. So we're going to be going to where America are now. So that's why we need to do something now. Unfortunately, even though what I'm going to now tell you about what we're doing in pregnancy is useful, I'm sure Tam mentioned it this morning, we have already closed the door after the horse has bolted, because we don't want these women when they're pregnant. We want them when they're 15. And that's when we need to be sorting it out. Because if we don't start looking at women that are starting to come into childbearing, so starting to go to GPs to ask for the pill, starting to go to family planning clinics, if we don't do something then and refer them on for weight management, then actually when they walk through our doors it's a bit too late, because you can't do anything major in pregnancy. Okay, the Foresight report is a report that came out in 2007 by the Department of Health, and what it did was it sort of forecast basically where we're likely to be with obesity. And it said by 2050 that 60% of men and 50% of women were going to be obese. So that's 50% of the women that are walking through our doors are going to be obese. And it also suggested that we need a multifaceted approach to actually sort out obesity. And that means that we need to target it from lots of different angles. And that may be targeting it in schools, it may be targeting it in pregnancy, in family planning clinics, in lots of different ways. So whether you're a health visitor working with families talking about diet, or whether you're a GP who's got someone walking in who's perhaps the age of 20, she's come for her pill, you've noticed that she probably has got a BMI that's fairly high, Why don't you put her on the scales? Why don't you measure her BMI and do something at that point? This is around lifestyle. We know that we're becoming more sedentary. Yes, people do go to the gym, but they're not walking and doing as much activity as they were doing before. Convenience foods. We know convenience foods, even though some of the labelling has got better, it's still got lots of hidden sugars, it's got lots of hidden fats. Everybody goes for the low-fat things, but actually they're still not that low in fat. We've got reduced exercise, knowledge. What's taught in schools nowadays about a healthy diet? And from working on the HELP study and going out and seeing women that are obese, it's really interesting to find out what they know about a healthy diet during pregnancy. And they don't know that much. But also I would ask the students, what are you actually taught in your courses as well? How much do you do on a healthy diet in pregnancy? Do you feel confident in talking about diet and exercise? Do you know the research that's behind it? But also, are you happy to raise the subject about obesity in pregnancy? Do you feel confident to do that when a woman walks into a room? And the genetics around that, and there's quite a lot on genetics. There's some studies going on around placentas and the links to obesity. So there's some things that are coming out. Okay, so is it an issue in pregnancy? Yes. We know that 1 in 5 in one of the research studies in 2005 showed that women were obese, but actually CMACE did a study about 2 years ago, and they showed that probably 1 in 4 women were obese during pregnancy. We know it's linked to generally poorer health, and I'll show you some of those bits now. But we also know that women that retain their weight gain after pregnancy can lead to long-term obesity. If they don't lose it by 6 months postnatally, they're very likely to lose it. And one of the major concerns that I've got is the celebrities that put on a lot of weight, get a personal trainer and then lose it quickly afterwards. Because all that's saying to women is fine to gain weight in pregnancy because actually you can show how much weight you can lose afterwards. That's not what we want. We don't want women gaining weight in pregnancy. We want eating to go completely. We also know that excess maternal weight gain during pregnancy is linked with obesity in children at 3 years and then into adolescence as well. So women eating a lot during pregnancy is really not on. And I think sometimes talking to some of the women, they say, well, actually, I've always worried about my weight, but when I'm pregnant, my body shape's changed anyway, so it doesn't matter what I eat. But actually it does. We need to tell them what's going on by them doing that. So what are the health implications for mum? Well, if you go to any medical clinic where there's a load of pregnant women, you will see women who've got high blood pressure. You will see women that get gestational diabetes. Now, again, when I first started as a midwife, gestational diabetes was quite a rare thing. But actually, how many women come through our doors now and have glucose tolerance tests? How much money are we spending on glucose tolerance tests? How many women are then ending up on diet-controlled with diet-controlled diabetes or even on insulin? And actually, we've made pregnancy abnormal just by having obesity as one of the factors. Also, increased emergency and elective section rates. Elective section rates, I think, is quite an interesting scenario because I think sometimes we get very concerned about the size of mum, the size of baby, and then we start talking about whether that woman should have an elective section. Also, if you've got gestational diabetes behind it and you've got high blood pressure, then that's another reason that you might go for an elective section. But if you also look at statistics in maternity units, the caesarean section rate doubles every time your BMI goes up. So when we looked in Cardiff at our caesarean section rate, once we looked at women with a BMI of 40 or more, 50% of those women had a caesarean section, which is scary, because that means that most probably they're going to end up with a caesarean section next time. Increased induction of labour rates. We know from the research that women that are obese are less likely to go into spontaneous labour. Now, the reasoning behind this is that the muscles of the uterus have actually got fat layers in between them. So the woman is less likely to have contractions that are good if she does go into labour, so she's more likely to need speeding up, she's more likely to end up with a caesarean, but she's also less likely to go into spontaneous labour. Venous thromboembolism, which was one of the biggest killers in the last CMACE report that looked at mums that died in the UK, is a huge issue with obesity. And actually, if you look at some of the thromboembolic guidelines that are around, it says that we should be going out and giving women injections to stop them having blood clots in pregnancy, and going out and seeing them antenatally, which it just feels so abnormal, doesn't it, when pregnancy is a normal thing. And the increase in postpartum hemorrhage, and again, unfortunately, I've seen quite a lot of women go to intensive care units that have lost massive amounts of blood. And this is again because of that fat that's in between the muscles of the uterus. So once the placentas come out, usually the uterus, the muscles clamp down to stop bleeding, but actually if you're obese, that can't happen.